shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Good day, everyone. Welcome to your pediatrics lecture. I am Dr. Adrian De Vera, and today we will be discussing topics in pediatrics genesis. Okay, so our objectives is to discuss basic topics in pediatrics that will hopefully be useful for your clinical practice and, of course, in your preparations for the medical board exam. Okay, this material will serve as a supplement for your top-notch main season review. So we will be discussing a lot of topics, and my style is to usually start them off with a case because I believe kapag meron tayong case, mas naaalala natin yung mga disease processes na dinidiscuss natin. Okay, after the Q&A, after the case, we will then proceed to a very brief discussion of each of these cases, and I will teach you the important things that you have to know. So we will be focusing on the must-knows and need to know. Okay, the content is based from your preseason handout. Okay, so hindi yung buong preseason handout nyo kumuha ko ng mga specific topics doon. And a lot of this are also based from Nelson's textbook of pediatrics, which is the Bible of pediatricians. Okay? So pagdating sa board exam, guys, a lot, probably 90% of the questions will be coming from Nelson. So kailangan talagang aaralin si Nelson. Okay? With this being said, okay, let's start, and I'm excited to teach you. Hopefully, you guys will learn a lot. So number one, for a 1-year-old child, okay, measurement should be, okay, so we're talking about anthropometrics, okay, measuring the weight and the height, okay, the head circumference, yung mga typical na measure natin, when a pediatric patient comes into your clinic, okay? So of course, sa pagtimbang ng weight ng bata, ano yan, ideally yan, pag baby yan, dapat nakahubad siya, okay? Preferably nga, walang diaper as much as possible para talagang makuha mo yung weight ni baby. Pero sometimes in the clinic, we just do about with, removing the dress, okay, tapos leaving the diaper on, okay? The same is true when you're measuring the height of pediatric patients. Siyempre, dapat walang sapatos yan, lalo na pag makakapal yung sapatos ng mga bata. And there's a proper way to determine the height or the length, yung haba nila. So, is it A, the recumbent length, okay? Ibig sabihin, nakahiga ba dapat, mini-measure yung length ng bata pag 1-year-old siya? Or letter B, the standing height? The answer for this one is, it's letter, okay? It's letter A. It should be the recumbent length, okay? So this table will guide you for patients less than 2 years of age, dapat yan recumbent length, nakahiga. For more than 2 years of age, dapat yan standing height, okay? This information is available in your preventive pediatrics, okay? Yung PPS, meron silang preventive pediatrics handbook. You should get a copy of those kasi maraming guidelines-based na information na makukuha dyan. And ano yung logic niyan? So studies have shown that the standing height is around 0.7 centimeters less than the recumbent length. So please remember that. So usually daw, yung standing height mo, okay, mas maikli siya ng 0.7 centimeters than the recumbent length. Why is this important? So for example, meron kang less than 2 years old, sabihin natin 1.5-year-old, pero ayaw humiga, hindi mo siya mapahiga. Kasi di ba, ang 1-year-old, based on your growth and development, di ba, 1-year-old, naglalakad na yan, di ba, stands alone and walks alone, di ba? Ayaw yung humiga, nagwawala siya. Okay, anong pwede mong gawin? You can get the standing height plus 0.7 centimeters. Okay? And the same is true if you have a patient that is 3-year-old pero hindi makatayo. So for example, okay, cerebral palsy, may cerebral palsy yung patient mo. So hindi mo siya makatayo dahil hindi siya makatayo, nakahiga lang siya. What can you do? You can get the recumbent, please change that, recumbent length. Okay, when it's recumbent, we call it length. Recumbent length minus 0.7 centimeters. Okay, is that clear? Okay, so again, the premise is the standing height is usually 0.7 centimeters less than the recumbent length. Okay, so 0.7 centimeters less than the recumbent length. So hope this is clear. Okay, another common question is, when do you routinely check the blood pressure of your pediatric patient? Okay, and my mnemonics to remember this is the number 3. So 3 years old. Okay, head circumference is routinely measured up to 3. Okay, so from birth up to 3 months, when you have a patient for consult, you have to routinely check the head circumference. Okay, 3 years onwards, you don't have to check for the head circumference anymore. We're talking about routine. Okay, you don't have to routinely check for the head circumference anymore, but you do have to check for the BP. Okay, routinely. Why am I emphasizing the word routinely? Ibig sabihin, guys, 4 years old, 5 years old, pero it's a case of hydrocephalus. It's a case of global developmental delay. It's a case of seizure. Of course, you still have to measure the head circumference. Okay, 2-year-old pero merong renal problem, hypertensive. Kahit 2 years old yan, you have to measure the blood pressure. So the 3 cutoff, the 3 mnemonics, okay, yung number 3, the age 3, is only applicable when we're talking about routine blood pressure and routine BP monitoring. Okay. Blood pressure and BP, sorry. Routine blood pressure and routine head circumference monitoring. So continuing our discussion for blood pressure monitoring in children, how do we interpret your BP monitoring or your BP values? Okay, so in this table, you will see how to know if the blood pressure is normal, if it is hypertensive, or if it is pre-hypertensive. So in pediatric patients, guys, ang ginagamit natin cutoff would be the percentile value. So a quick way to remember it is, if it is less than 90th percentile, that is normal. Okay, if the systolic or diastolic is equal to or greater than 90 but less than 95, that is pre-hypertensive. And if it is equal to or more than 95 percentile, on 3 or more separate occasions. So this is very important. Before you call that the patient is hypertensive, it should be on 3 or more separate occasions. So 3 or more separate occasions. Lalo na sa mga teenagers, pwede kasi magkaroon ng white coat hypertension na tinatawag. Di ba? Pag kinakabahan sila, pag pumapasok sa clinic ng doctors, isipin nila, baka may bakuna sila, may tusok. So falsely, nag-elevate yung BP nila. But if you do get 3 or more values that are elevated, okay, then you can diagnose the patient as hypertensive. So again, more than or equal to 95th percentile. So this is based again from your pediatric preventive handbook. So this is an example of that handbook, although this is already old. This is 2016. Meron na tayo mas bagong version. So please do get a copy of this handbook, okay? So more recent guidelines, the most recent one is from AAP, American Academy of Pediatrics. Okay, so the cutoff values are shown in your screen. This is from the article, the journal article written by Flynn. Okay, so medyo hindi naman sobrang lalayo dun sa pinakita ko sa inyo. So ito kasi guys, this is the easier way to remember it. And I think probably if your examiner is not a pediatrician, baka ito yung mga values na gamitin nila, ito yung medyo mas common knowledge. But you also have to know this dahil baka ito yung tanongin nila. So medyo mas mabusisi, mas maraming values. So there are cutoffs for age 1 to 13 and for above 13, adolescents and adults. And actually this is the latest guidelines, if I'm not mistaken, for adults as well, diba? So there's normal, there's elevated, that's pre-hypertensive. Stage 1 hypertension is 130/80 to 139/89, diba? And stage 2 is more than or equal to 140/90. So in children, okay, less 1 to 13, ganun din guys. So normal is less than 90th, so hindi naman sinabi ko sa inyo. Medyo iba lang ito ng konti. Elevated, sabi niya, it's more than or equal to 90th to less than 95th. Okay, so that's pre-hypertension. So, di ba, parehas lang. Okay, or meron kang cutoff values, 120/80, okay, to less than 95th percentile, whichever is lower. Okay, stage 1 is more than or equal to 95th to, ito yung mas naiiba ngayon. Dati dito, yung stage 1 natin, okay, actually yan, stage 1, stage 2, more than 95th, ang stage 2 dati, more than 99. Ito ngayon, okay, more than 95th percentile to less than 95th plus 12. Okay, so, Doc, ano yan, i-compute ko all the time? Well, mahirap mong i-memorize at mahirap i-compute to dahil may table. So, kailangan usually kami mga pediatricians sa clinic namin, may table kami tinitingnan dahil doon namin binibase yung mga percentile values, okay? So, bigyan ko kayo ng example para mas madali nyo maintindihan. Okay, so tingnan natin to ha. So, for example, ito madali lang to 130/80 to 139/89. Yan, absolute values yan, di ba? Pero ito ngayon kasi percentile tayo. So, for example, this is the table available from the said journal again, from AAP. Pag download nyo yung journal, meron sa kanilang, anong tawag sa part ng journal na yun? Hindi siya abstract. Meron sa kanyang appendix, sa mga appendix ng journal na to. So, ito yung table mo. For example, let's see. So, what you do is you need the age of the patient and the height. Okay? So, based on the Z-scores, for example, you have a patient who is 8 years old at ang height niya ay, sabihin natin, nasa 50th percentile, 130 centimeters. For example, nasa 130 centimeters siya. Ito yung mga cut-off values mo. Okay? So, nandiyan na lahat. 50th, 90th, 95th, 95th plus 12. Okay? So, sabi dito, hypertension stage 1 is more than or equal to 95th to less than 95th plus 12. Okay? So, balikan natin yung case natin. For a 8-year-old patient who is 130.6 centimeters, ang 95th niya is 113, ang 95 plus 12 niya is 125. Ibig sabihin, if your systolic blood pressure is less than 110, your patient is normotensive. If your systolic blood pressure is from 110, okay, papuntang less than 113, your patient has elevated BP. Tama ba? Balikan natin ulit. Okay? So, elevated BP is more than or equal to 90th but less than 95th. So, tama. So, 110 to 112, less than 195 kasi dapat elevated BP yan. Okay? And kapag ang BP niya ay more than or equal to 95th pero less than 95th plus 12, so for example, 113 to 124 ang kanyang systolic, that is hypertension stage 1. And by definition, ang hypertension stage 2 is more than 95th plus 12. So pag more than 125 na siya. Okay? More than or equal to. Okay? Malinaw ba? So it's a bit technical, but I want to teach you this so that you will have an idea on how to check the blood pressure and interpret the blood pressure in children. Okay? So again, bigyan natin isang example. Last one, quick example. For example, 9-year-old na patient. Okay? Iba pa yung female, iba pa yung male. This table, I think, is, I copied this table. This is for males, I think. So for example, 9-year-old na matangkad kunwari siya 140.1 centimeter. So nandito tayo. Okay? So normotensive if less than 112. Okay? From 112 to 115, that's hypertension, elevated BP. Okay? From 116, okay, up to 127, that's hypertension stage 1. From more than or equal to 128, that is hypertension stage 2. Okay? So I hope that is clear. So next case. You're the intern on duty. Okay, the delivery room, you were called to attend to a normal delivery, 24-year-old G1 mother with unremarkable maternal history. Upon delivery of the baby, paglabas ni baby, what is the most important step that you should do? Is it letter A, should you check for the heart rate? Letter B, should you transfer the baby to an incubator? Letter C, should you thoroughly dry the baby? Okay? Or letter D, should you check for the respiratory rate? Okay? So this is a very basic question, guys. Ano bang unang-unang dapat na ginagawa? And to answer this question, you have to go back and review your EINC, your Essential Intrapartum Newborn Care. Okay? Essential Intrapartum and Newborn Care. Your unang yakap. Okay? And the answer should be, it's letter C. You should thoroughly dry the baby. So again, please remember these steps. This is very important. Okay? So it is chronologically arranged. It is time-bound intervention. Okay? Very important yun. Chronologically arranged time-bound intervention that your newborn should receive at birth. And what's the purpose of EINC? Okay? The purpose of EINC is to decrease mortality and morbidity for both the mother and the baby. Okay? So you have to know the steps and you have to know why you're doing it. So number one, step one is immediate drying. Paglabas ni baby, kailangan mo siyang tuyuin agad. Okay? And this is very important. You're trying to stimulate the baby. Okay? Kailangan niyang ma-stimulate para umiyak siya, para huminga siya. Okay? Yung pag-iyak ng baby, that's a very significant process, guys. Mag-open up yung lungs, yung blood flow ng heart, mag-iiba yung direction, okay? From a flow na meron kang shunting na right to left because of your fetal shunts. Okay? Kapag bumagsak na yung pressure sa lungs dahil umiyak si baby, dahil huminga na siya, your pulmonary pressure will decrease. It will promote blood flow going through the lungs. Okay? Yung dating placenta ang iniikutan ng dugo, ngayon pumupunta na siya sa lungs. Tapos yung mga shunt mo sa heart, nag-iiba na yung shunting niya. Nagsasara na yung mga shunts, di ba? So we will discuss that more in depth when you discuss your cardiology topics. Okay? So suffice it to say, at this moment, that stimulation is very important. You have to stimulate the baby para huminga siya, para mag-expand yung lungs, para bumagsak or mag-decrease yung pulmonary pressure. And another important reason for drying would be thermoregulation. Thermoregulation is very important for newborns, okay? A lot of newborns, if not thermoregulated properly, will deteriorate, okay? Your hypothermia leads to a cascade of problems that is very detrimental to your newborns, okay? Pag hypothermic sila, hindi maganda yung energy production nila, okay? Babagsak yung energy production, magkakaroon ng hypoglycemia, pag nag-hypoglycemia, magkakaroon sila ng acidosis, so forth and so on. Okay, kaya ako minsan, I see a lot of babies being referred to me, sabihin, Doc, si baby takipnik po siya. Pero when I review the history, the mother is well, walang sakit, unremarkable birth. Bakit nagtatakipnik tong baby? Clear yung breath sounds. Only to find out when I ask, what's the temperature? The baby is hypothermic. Okay, so I instruct them to thermoregulate, and true enough, after thermoregulation, mag-i-improve na yung breathing ni baby. Mas magiging active na siya, mas less na yung takip niya. And that happens a lot. So, a lot of doctors are forgetting, a lot of nurses are forgetting, guys. Please do not forget, please remember, okay, thermoregulation is very important. Okay, the second step is skin-to-skin contact. So, please remember this is skin-to-skin contact. It is not cord clamping. Okay, yung iba kasi napagpapalit, nagiging cord clamping. Okay, we're talking about NSD, guys, ha? So, spontaneous delivery. After you dry, what do you do? Ipapatong mo muna si baby. Okay, kay mother. Skin to skin muna. Okay? If this is cesarean section, then yes, pwede siya magbaliktad. You can clamp the cord first bago mo siya ipatong na skin to skin kay mother. Okay? Pero if it's NSD, it's skin to skin contact. So, it prevents hypothermia. It increases colonization with protective bacteria. So, there are good bacteria in the mother's skin. Mind you, it increases breastfeeding success and exclusivity. So, a lot of mothers who are able to do skin to skin contact during the first few hours of life have higher success of breastfeeding. That's very important. Okay? And when they ask you in the exam, how long should you do your skin to skin contact? The answer is around 60 to 90 minutes of life. Okay? Doc, paano pag nasa choices 60 sa 90? Your answer would be 60 minutes because more references would say that it's 60 minutes. Okay? The most recent guidelines from your society, from our local society, the Newborn Society of the Philippines, okay, would state that you should do your skin-to-skin contact until after the first full breastfeed, okay? So, which coincidentally, yun din naman papagsak yun. The first full breastfeed would be finished at around 60 minutes of life, okay? Number 3 is properly timed cord clamping. And when you say properly timed cord clamping, ano yung timing yan? It's 1 to 3 minutes or until the pulsation stops, whichever comes first, kung ano man yung mauuna. Okay, so that's clear, okay? Whichever comes first. Ibig sabihin, 4 minutes na may pulsation pa rin, dapat na-clamp mo na yun na 3 minutes, okay? For example, wala pang 1 minute pero wala nang pulsation, pwede mo na siyang i-clamp. So 1 to 3 minutes or when the pulsation stops, whichever comes first. And what's the purpose? It decreases anemia for your full-term and preterm babies. That's both for full-term and preterm. And for preterms, meron pa siyang additional benefit. It decreases the incidence of your intraventricular hemorrhage or your brain hemorrhage. Okay? And lastly would be non-separation of mother and baby to promote breastfeeding. Okay? So those are the 4 steps. Okay? Please correct this. This should be step 4. Okay? That's the 4 steps of your EINC. Very important to know the timing. Very important to know the steps and of course the rationale or the purpose. Okay? If they ask you when do you bathe the baby, before the answer was 6 hours, the recommendations today, the latest recommendations would be to give the baby the first bath after 24 hours of life. Okay? Next case, after the first minute of life, the baby has the following findings. So after the first minute, lumabas si baby, nag-dry ka na, nag-skin to skin ka na, your heart rate is 120, your RR 50, the color is pink with purple extremities, the baby cries on stimulation, has active movement of the extremities, and the question here is what is the APGAR score? So mind you, this is very important. Okay, you have to know how to compute for your APGAR score. Okay, this is something that is very basic, but sometimes guys, nakakalimutan natin, sometimes nalilito tayo, sayang yung 1 point sa exam. Okay, so this is your APGAR scoring. This is devised and developed by Dr. Virginia Apgar. Virginia Apgar. She is an anesthesiologist. Before kasi guys, nagkakaproblema sila on how to assess the baby, lalo na pag nabibigyan ng anesthesia. So Dr. Apgar devised a way to easily screen or score these babies depending on the 5 activities, parameters, which is activity, pulse rate, reflex irritability or grimace, appearance, and respiration. Okay, so numbers to remember sa heart rate is 100. Okay, tapos all of the rest are descriptive. So let's go back to this patient. Okay, so heart rate is 120, that is 2. Okay, again, remember the score is 012. Okay, so again, the Apgar score is 012. So heart rate is more than 100, 2. Respiratory rate is 50, the normal is 40 to 60. Okay, and again, even if the rate is falls within normal, titignan mo rin yung manner and effectivity of breathing. Okay, so 2 rin yan. Acrocyanosis is 1. Cries on stimulation, that's 2. Active movements, that's 2. So your score is 9. Your APGAR score is 9. So sabi dito, ito yung interpretation, excellent yung condition niya. Okay, so remember that the APGAR score is done on the 1st and 5th minute of life. Okay, 1st and 5th minute. Yan yung routine natin. You do not do your APGAR score immediately paglabas ni baby. Okay, hindi yung lalabas pa lang siya ng puwerta, na-APGAR mo na siya. No, that's not how you do it. Okay, so you still have to dry, you still have to stimulate the baby. On the 1st minute, that's when you check for the APGAR. And then on the 5th minute. Okay, remember that APGAR scoring is retrospective. Okay, so hindi siya yung priority mo pag naglabas ni baby. What your priority is to perform your EINC, and if the baby needs resuscitation, you resuscitate the baby. Tapos saka mo na lang aalalahanin, retrospective, saka mo na lang aalalahanin yung APGAR score. And why do we do the APGAR scoring? The quick answer is for the assessment of the neonate. Okay, please remember that the APGAR score is not there to dictate your steps of resuscitation. Okay, it will not tell you if you should resuscitate or not, because that will depend on the general condition, on the overall condition of the baby. Okay, it is just there for quick assessment. Your APGAR score will not dictate mortality or morbidity. It will not dictate the presence or the probability of neurologic sequelae. Meaning, hindi lahat ng pangit yung APGAR magiging morbidity or mortality. At hindi lahat ng nagkaroon ng morbidity, ng complications, for example, asphyxia, hindi lahat ng mga yan pangit yung APGAR nila at birth. So, hindi siya related. Okay, so please remember that. Okay, so having said that APGAR is for assessment and that it should not dictate your steps for resuscitation, let us now discuss neonatal resuscitation. Very important, okay? So for those of you who have rotated in the NICU, who have experienced resuscitation, then that's good. This will be very quick and easy to understand for you. For those who have not, or for those na nakalimutan, hopefully we can make this comprehensive, okay, brief, and yet sana maalala niyo important points. So this is basically neonatal resuscitation 101, okay? So hopefully I will be able to teach you the important points in resuscitation. Okay, number 1, remember your priority. During the neonatal period, which is 0 to 2 months, in some references 3 months, okay, remember that your sequence is ABC, airway, breathing, circulation. Okay? Very different beyond the neonatal period. Pediatric population, adolescents, and even adults, ang tinuturo na natin ng AHA ngayon, American Heart Association, your priority is circulation, CAB. Okay, so please remember, in the neonate, it still remains to be ABC. Your airway is your top priority. Okay, so this is a quick overview of your essential in newborn care and resuscitation 2019 guidelines from PSNM, okay, PSNBM, Philippine Society of Newborn Medicine. Okay, so again, please do remember this. It's not that easy to understand. You just have to remember the important points. So we will run down the steps one by one, again, very briefly and concise, pero hopefully marami kayong matutunan. So let's go and focus here on the slide. Okay, so at birth, what do you do? Immediate and thorough drying quick assessment, which is basically your EINC. Okay, so the important question to ask after drying and stimulating the baby would be 2 things. Dalawa lang yung pinaka-importanting tatanungin nyo. Is the baby apneic or gasping? Hindi ba siya humihinga? Is there a problem in respiration? Again, ABC, airway, di ba? Pinaka-important. Is the baby apneic or gasping or limp? Okay, because if the baby is apneic, gasping, or limp, then you immediately clamp the cord and do your resuscitation. So dito tayo, this is the resuscitation step. But if the baby is breathing well, hindi siya apneic, hindi siya gasping, and hindi siya limp, active siya, then basically you proceed to your EINC. This is just your EINC. Okay, so again, we discussed EINC already. Let's go back and focus here in this part, resuscitation. So what do you do if the baby is apneic, gasping, limp? Okay, so this is what you do. You call for help. You immediately change the wet linen. Again, guys, yung wet linen, pag yung pinalit ng hypothermic yung baby, you clamp the cord kahit wala pang 3 minutes because your baby is needing of resuscitation. Transfer to warmer, position the airway, very important. So a lot of these kids, hindi lang sila makahinga, nahirapan sila makahinga, baka mamaya may obstruction pala, may bara pala, or nag-obstruct pala yung tongue, whatever cause of it. Okay, again, emphasis on the airway, clear the secretions if needed, okay? And then you give your oxygen and your positive pressure ventilation. Okay, so mabilis lang yan. All of this should be done within 60 seconds. And yung first 30 seconds yan, actually, yun yung drying sa stimulation nyo. Okay, so pag tinanong kayo sa exam, how long does it take to stimulate and to dry the baby? The answer should be 30 seconds. Okay, ang sequence ng 30 seconds na yan ay face, head, trunk, back, arms, legs. Madaling tandaan, di ba? Face, head, trunk, back, arms, legs. So 5 seconds each. Face, legs, trunk, back, arms, legs. So total of 30 seconds. Okay? So in essence, yung management na to guys, 30 seconds lang dapat yan. So 30 seconds mong stimulate pa rin, secure the airway, give your oxygen support and positive pressure ventilation, your ambu bagging. Okay? Lalo na pag apneic or gasping ang baby. Okay? And when they ask you what's the sequence of ambu bagging, of bagging your baby when you're doing your resuscitation, okay? It's breathe 2, 3, breathe 2, 3, breathe 2, 3. Okay? We're talking about ambu bagging kapag hindi intubated yung bata. So breathe 2, 3, breathe 2, 3. Okay? So that would hit around 40 to 60 breaths per minute. Okay? Kapag intubated na yung bata, when you're doing CPR, iba naman yung cadence or yung counting nyo. It's 1 and 2 and 3 and bag. 1 and 2 and 3 and bag. Okay? So please remember that. Okay? So breathe 2, 3, tapos 1 and 2 and 3 and bag kapag intubated. Okay, so going back. After 30 seconds, 60 seconds total, di ba? Stimulate dry, lipat mo sa warmer, PPV, O2 support, okay, and positive pressure ventilation, okay? After 30 seconds of doing that, you reassess the baby. Apneic and gasping pa rin. Heart rate is less than 100. What do? You proceed further with your ventilation corrective measures. Again, our focus in neonates is the airway. And ano yung ventilation corrective measures na yan? That's your Mr. SOPA, okay? Mr. MRSOPA. Readjust your mask, baka mali yung adjustment, reposition the airway. Baka masyado siyang naka-flex or masyado siyang naka-extend. Suction the mouth and the nose, baka may bara lang pala. Open the mouth. You might need to increase your pressure. You might need to provide your PEEP, your positive and expiratory pressure. Or you might consider alternative and advanced airway, okay? And then, how long do you do this? Again, 30 seconds na naman. After 30 seconds, wala pa ring improvement, you consider intubation. At any point in time na bumagsak yung heart rate niya to less than 60 beats per minute, you have to do your coordinated positive pressure ventilation and chest compressions again at the cadence of bag 1, 2, 3, 1 and 2 and 3 and bag, 1 and 2 and 3 and bag. Okay? So, if, okay, ganun pa rin, hindi pa rin tumataas yung heart rate, na-secure mo na yung airway, then consider giving epinephrine, consider hypovolemia. Baka naman pala nag-bleed tong mother, in which case you give your saline solution to restore your volume, or baka may pneumothorax siya. Okay? So, this is the basic step of resuscitation. Okay? So, again, the next few slides just zooms it in para mas makita nyo. So, again, quick review. Stimulate 30 seconds, oxygen and bagging 30 seconds, hindi nag-improve, ventilatory corrective steps, intubate if needed, another 30 seconds. So, 30 seconds lang yan, mabilis, di ba? Oxygen, hindi gumana, 30 seconds, bagging, 30 seconds, naka-intubate na yung bata. Okay? And then so forth and so on. So again, the emphasis for your resuscitation of newborns revolves around, again, addressing the problems of airway. Because majority of the problems kapag nag-deteriorate ang newborn would be the airway. Very crucial for them ang kanilang airway. Okay? Let's discuss some other important features when catching a newborn. Okay? Lalo na mga well baby. This would be your anthropometric measurements. So please remember that you plot these measurements against a normogram. So you have a chart that you can use for that. That's your Lubchenco chart. Okay? And also take note that we use a different chart for preterm infants. Okay? So I hope everyone's familiar with this. This is your Lubchenco chart, where you can plot the length, okay, the weight, okay, and your head circumference. So just to give you an idea how to use this. So for example, yung weight, guys, this is used to know if your patient is AGA, SGA, or LGA. So pagpasok siya dito sa 90 to 10, that's AGA. Dito sa baba ng 10, small for gestational age. Beyond this, it's large for gestational age. So for example, your newborn is 37 weeks, okay? Tapos ang timbang niya ay 2,500, so that is AGA, okay? Pag lampas siya ng 3,250, then that will be LGA. Pag less than, ang 37 weeks less than 2,000, that would be small for gestational age, okay? So please do remember these important facts, okay? Low birth weight is not, okay, the same as small for gestational age. When we say small for gestational age, we're talking about the gestational age, the weight plotted in your chart, in your Lubchenco chart, okay? But when we talk about low birth weight, extremely low, very low, we're just talking about the weight. Wala tayong pakialam sa gestational age, okay? So pag less than 2.5, that's low birth weight. Pag less than 1.5, that's very low. Pag less than 1, that is extremely low, okay? So again, let's go back and give an example. So, ang less than 2.5 is considered low birth weight. For a 37-weeker na ang timbang niya ay 2,250, that is low birth weight but still appropriate for gestational age. I hope that's clear. Okay. So, other important things to remember, this has been asked in the previous board exam, temperatures, very important. Again, sinabi ko sa inyo yan, thermoregulate your newborn. The normal temperature for newborns is 36.5 to 37.5, okay? Newborns should be maintained at a room temperature, okay? Meaning, yung temperature ng delivery room, yung temperature ng NICU, ng NICU, should be 25 to 28 degrees Celsius. So, please remember that, okay? Let's go briefly in your maturity rating, maturity scoring, your Ballard scoring, okay? This is something na hindi na ituro sa amin during our clerkship and internship. It's something na tinuro ng mga seniors nyo, pero hindi na ituro in detail. So, it's available online, but we will go through it very briefly para may idea kayo kung paano gamitin yung Ballard score and kung paano siya i-test sa mga patients nyo. Kasi kung minsan nalilito kayo, paano ba talaga yung square window na yun? Paano ba talaga yung scarf sign na yun? Okay? So, you score it as early as possible, but it may be reliable after 3 days of life or 72 hours, okay? For full term, for preterms, up to 12 hours lang. Pag more than 12 hours na sa preterms, medyo hindi na siya ganun ka-reliable, okay? But you can still do it, okay? It's composed of physical and neurologic scores, okay? And then you add both of those scores, okay? For example, if your newborn has poor activity, for example, like seizure, asphyxiated siya, meron siya hypoxic episodes, okay? Then what you can do is, since your neurologic score would not be that accurate, what you can do is, you can simply multiply the physical score by 2. And then we assess once the newborn is more stable, okay? So, these are the components of your neurologic score. You have your posture, square window, arm recoil, isa-isa natin daanan yung mga yan, as well as your physical score, okay? So, the posture, okay? How do you check for the posture? You put the baby in supine position, you wait until the baby is relaxed. You do not check when the posture habang umiiyak yan, habang gumagalaw yan. Siyempre, pag gumagalaw yan, kala mo ganito yung score niya, baka mamaya hindi pala yun, mas mababa pala. Okay? So, when the baby is relaxed, then you look for the flexion or extension of the extremities. The premise here is that more mature babies, the flexural tone would predominate. So, pag mas naka-flex, mas mature. Pag mas premature yan, mas extended ang kanilang tone. Okay? How do you check for the square window? So, this is how you do it. Straighten finger, okay? And apply pressure on the dorsum of the hand, okay? Straighten the finger and apply pressure on the dorsum of the hand, okay? The premise here is for term infant, there's less angle between the palm here, and the forehand, okay? There's less angle between the palm and the forehand. So, this is for term infant. So, again, yan. For square window mo, pag yung mga preterm mo yan, mas malaking angle. Habang nagiging mas term siya, mas lumiliit yung angle between the palm and the forearm, okay? Forehand, okay? Next is your arm recoil. How do you check for your arm recoil, okay? One hand beneath the elbow for support, okay? So you put one hand beneath the elbow, flex the elbow momentarily, straighten, and then release. Okay, so that's how you do it. So, hawakan mo siya, okay, sa ilalim, flex it, straighten, bitawan mo siya. And then you check for the angle. Okay, so one hand, you place one hand beneath the elbow for support, flex the elbow momentarily, straighten, and then release. And then you check for the angle of your arm recoil. Okay, again, kapag mas mature yung baby, mas mag-flex siya. Okay, because in mature infants, ang nagpredominate is your flexural tone. Okay, how do you check for the popliteal angle? So how do you check this? First, you place the thigh on the infant's abdomen with the knee fully flexed. Fully flexed. PNF confusion. Fully flexed. Okay, so ilalagay mo yung thigh, itong thigh, ididikit mo siya sa abdomen ng bata, and yung knee niya fully flexed, so nakatupi. Okay, with the knee fully flexed, so nakatupi pa yan. One hand grasps the foot, the other hand supports the thigh, the leg is then extended, so i-extend mo siya until resistance is felt. Okay, so hindi mo siya kailangan pilitin kung saan yung pinakamalayo. No, i-extend mo siya until resistance is felt. And where you feel the resistance, that's where you record it. So kapag preterm yan, wala kang resistance hanggang dito. Kapag full term or mas mature yung baby, mas maagang papasok yung resistance. So again, dikit, with the knees flexed, dahan-dahan i-extend mo siya. How do you check for the scarf sign? Infant is supine, head is midline, one hand supports the infant's hand across the upper chest, another hand is placed on the elbow. Okay? Nudge the elbow across the chest, again, feeling for resistance. Okay? So kapag mas preterm, mas walang resistance, pwede mo maitulak yan hanggang may tawid mo siya sa kabilang side, pero pag yung mga mas mature, mas maagang papasok yung resistance. Heel to ear. Okay? Usually, napagpapalit yung heel to ear saka yung, popliteal angle, di ba? Heel to ear, again, patient is supine, flex lower extremity is brought to rest on the mattress alongside the infant's trunk. Oh. So dapat yan, yung lower extremity mo, ito, ididikit mo siya dun sa mattress, ipapatong mo siya. Okay? Foot is then pulled towards the ear, and then again, you feel for resistance, kung saan yung resistance niya. Okay? Let's go to physical assessment. So you check for the skin. Madaling i-describe yan. Nandiyan na yan. Self-explanatory. Lanugo is very important. Anong meaning ng sparse saka thinning? Okay? You have to understand, guys, how lanugo appears and disappears. Okay? Lanugo appears at the lower part of the back first. Sa lower part, going up. Okay? It also disappears in the same manner. Mas maunang makalbo yung lower part, going up. Okay? When you say sparse with a score of 0, ibig sabihin yan, may lanugo ka sa baba, sa shoulder area, sa taas, wala pa. Kasi kakalabas pa lang niya, kaya siya sparse. Okay? When you say it's thinning, ibig sabihin, may lanugo pa yung shoulders mo, pero yung lower back, kalbo na. Kasi nawawala, nag-start na mag-disappear yung lanugo. Malinaw ba? So it starts to appear from the lower part of the back going up. It starts to disappear from the lower part going up. Okay? And why is that important? Because sparse is more premature as compared to thinning. So you have to know the difference. Okay? You check also for the plantar surface, for the breast. Again, mas madali itong mga to. These are self-explanatory. And for the eyes and ear, as well as the genitalia. Okay? And how do you score them? Then you have the table. So physical plus neurologic score, and then you look at the table. If it's 30, 36. If it's 35, that's 38 weeks. Kuminsan nalilito yung mga students sa in-between. Okay? Kuminsan, depende sa institution kung saan kayo nagpa-practice. Kuminsan meron pa silang 36 to 37, 35 to 36. Diba? May mga ganun. So it depends on what institution you're practicing. More of ano lang to parang nakagawian. Okay? This is for me the easier method. So for example, 30 to 35. So sulat mo 30, 31, 32, 33, 34, 35. And then just divide it. 2 each, assign 2 each. So 30 is 36, 31 is 36, 32 is 37, 37, 30. So mas madali. So this is what we do. Okay? And a lot of institutions use this as well. Yung mga 36 to 37, yun yung medyo nakakalito. What they do, I think, is, I'm not sure what they do. I think they assign 32 to 33 as 37. Tapos ito, ang score nito is 36 to 37. Tapos ito is 37 to 38. Parang ganun yata. I'm not really sure. So this is the method that we use. Okay? I think in PGH and in PCMC, this is what we use. Okay? So other important reminders for neonatology. Okay, suctioning is not routinely done for stable neonates. Okay, so hindi lahat ng newborn kailangan mo i-suction. It's not even part of your EINC. Okay, there's no benefit, there's additional risk. Okay, so don't do it unless it's needed. So pag puno-puno ng secretions, may obstruction, then yes, of course you do your suctioning. Okay, newborn screening ideally on the 48th hour of life. Okay, but as long as you do it after 24 hours, it is acceptable. Okay, for preterms we delay it. So usually 1 to 2 weeks bago natin ginagawa for premature. Okay, healing screening is done prior to discharge. Okay, urine output and bowel movement. Tinatanong yan, kailan dapat lumalabas yung urine output and bowel movement? Ideally within the first 24 hours of life. But if they ask you ano ba yung limit, it's still considered normal as long as you have your urine output within the first 24 hours. Okay, it may still be normal as long as you have your meconium output within the first 48 hours. So 1 day saka 2 days. So limit natin, ihi, wiwi, 1 day, dumi, pupu, 2 days. Okay? Remember that there's what we call a physiologic weight loss. So mag-discharge ng fluids sa katawan yung babies, paglabas nila, babagsak talaga yung timbang nila. So it's perfectly normal if your babies are decreasing in weight as you check them day by day. Sometimes the mothers panic. Okay? You have to reassure them there's what we call a physiologic weight loss, and that's around 10 to 15% weight loss within the first 2 weeks of life. Okay? So for preterms, 15 to 20%, mas mataas yung allowable. For full terms, it's 10 to 15% within the first 2 weeks of life. Meaning kapag 3,000 grams yung newborn mo, he is allowed to lose around 10%, which is 300 grams during the first 10 to 14 days of life. Okay? So of course, pag day 2 pa lang, binagsak na yung 10%, mabilis yun. So we have to be wary. You have to check kung ano yung problema. Okay? So weight gain after the 14th day of life, your newborns gain at an average 15 to 20 grams per day. So these are the nitty-gritty. Maybe, baka tanungin. So pwede. Okay? Again, remember, breastfeeding is the gold standard. Exclusive breastfeeding. Okay? It's free, it's safe. There's a lot of benefit to it as compared to formula where it's expensive. It increases the chances of infection, gastroenteritis, pneumonia. It also increases the risk of developing asthma, hypertension, so forth and so on. So for the first 0 to 6 months, it should be exclusive breastfeeding. But do not forget, okay, 6 months onwards, you have to start your complementary feeding. And they usually ask this, how do you prepare your food for these babies? At 6 months, it's mash. At 8 months, it's finger food. At 10 months, it's chopped food. And by 1 year old, they should be eating regular table food. So kung ano yung kinakain sa hapagkainan ng parents, dapat yun na rin yung kinakain nila. Okay? Breast milk storage according to the PPS guidelines. Okay? Please do review this kung minsan tinatanong yan. Okay? There's also one international guidelines na pwedeng tanungin sa inyo. Please do research on La Leche League International, LAL, La Leche, as in La Leche. La Leche League International. Yan yung mas widely accepted na international guidelines on the breast milk storage. The PPS guidelines is very similar, although yung cut-off natin is medyo mas mababa. For example, yung deep freezer, which says here 6 months sa La Leche League, if I'm not mistaken, it's 6 months to 1 year. So why is the PPS guidelines nandun sa lower threshold? Because mas mainit sa Pilipinas, nasa tropical countries tayo. So basically that's one of the reasons. Okay? So please do check that out and please do review this. Usually lumalabas sa exam yan. Okay? Okay, so the next few topics would be on important aspects in preventive pediatrics. So again, the handbook of the PPS PrevPed that I showed you, please do get a copy of those. The nitty-gritty details are there, but the most important parts we will be discussing here. So iron supplementation. So we give iron to prevent iron deficiency anemia, one of the most common causes of anemia in children, specifically for those less than 2 years of age. And one of the main reasons is because of dietary factors, so the lack of sources of iron in the diet. Okay, so depende yan sa lugar. Hindi lahat ng bansa nagbibigay ng prophylactic iron therapy, so or iron supplementation. So here in the Philippines, we do it as part of our routine measures. Okay. So how much iron do we give? Do you have to memorize the nitty-gritty details? I don't think so. It's important that you know when to give it. We give it for low birth weight infants. Okay, so this is the only indication of giving vitamins to your newborns being discharged in the hospital. So again, mind you, if the mother asks, Doc, kailangan ba ng vitamins ng anak ko bagong panganak? The answer should be no. Okay, because as you will learn during your main review, okay, a lot or every nutrient need by a newborn baby is met by your breastfeeding or by your breast milk. Okay? Lahat ng kailangan ni baby nasa breast milk na yan. Okay? So, mapaanong micronutrients man yan? Iron, vitamin D, vitamin K, lahat yan nasa breast milk. Insufficient amount. Okay? Sufficient. Okay? Insufficient. Ibig sabihin sufficient yung amount niya. Bawal to kayo sinabi ko insufficient. So, it's not insufficient. It is sufficient. Okay? So, however, okay, for your premature babies, for your low birth weight babies, here is where the problem comes in. So, your premature, your low birth weight babies, mas konti yung store nila ng mga micronutrients. Mas prone sila mag-develop ng deficiencies. And that's why we supplement them. Okay? So, for low birth weight baby, that's 15 milligram. Okay? Per 0.6 ml, this is the preparation, but we only give 7.5 milligram. That is why we give 0.3 ml once a day. Okay, so again, for low birth weight babies, we give 0.3 ml. Okay, so that is 7.5 milligrams kalahati once a day. Okay, to start at 2 months of age until 6 months. Okay, what about for normal babies who are breastfed, who are healthy? We start at 6 months. Okay, so the same time that we start our complementary feeding, dun din tayo mag-start ng iron supplementation. At ang dose nila, ito na yun, full dose, 15 milligram. So 0.6 ml once a day for 3 months. Okay, for children 1 to 5, so we also give another routine supplementation. Pagtungtong nila ng 1-year-old, 1 to 5, it's 30 milligram this time, 5 ml once a day for 3 months. Okay, and of course for female adolescents, yung mga babae, lalo na pag nag-menses na sila, we give your iron preparation with folic acid. Okay, diba? To prevent your neural tube defects. Okay, please do take note that there are various preparation of iron. Okay, when we say 15, 30, 60, we are talking about the elemental. Okay, the elemental quantity of iron. And please take note that for this one, the most common preparation will be ferrous sulfate. It's preferably taken on an empty stomach. The absorption is better. Okay, it's preferably not mixed with milk. When you mix it with milk, okay, kapag naging basic yung pH ng tiyan, mas hindi rin siya na-absorb. Okay, and ideally there are recent studies that have shown that once a day dosing is preferred than if you're going to give it in multiple divided doses. Okay, so please do remember that. So next would be deworming. Okay, so pag tinanong kayo, when is deworming done? Okay, it's recommended for all children 1 year up to 12 years of age. And you usually have two options. You can give albendazole or mebendazole. Okay, this is the common drug used for routine. I'm talking about routine deworming in children here in the Philippines. Okay, so for 12 months to 23 months or less than 2 years old, albendazole is 200 milligram. For 2 years old patas, it's 400. Mebendazole mas madali, which is what I use in my practice. Mas madaling tandaan. Basta pas mataas siya ng 1 year old, 1 year old and above, it's just 500 milligrams, same dosage. Okay, single dose. Okay, every 6 months. So you give your deworming for 1 year old to 12 years old, ideally every 6 months. Okay, so pag meron kayong mga chikitings, mga bata sa bahay at hindi pa napupurga, more than 6 months na, you can give them this drug. Okay, so again, routine deworming, depende yan. Hindi lahat ng bansa nag-routine deworming. Pero syempre, in third world countries like in the Philippines, mas mataas yung incidence ng intestinal parasitism. Okay, I hope you are all familiar with the growth chart. Sorry. Pakikat na lang yung inubo. Okay, so I hope you're all familiar with the growth chart. Okay, I'm sure ginagawa niyo to during your internship, your clerkship, pag nasa Pedia OPD kayo, di ba? Ipa-plot niyo yung weight, yung height. Why is it important to be able to know if your patient is in the normal range of weight, height, and weight for height, BMI, head circumference, whatsoever. Okay, so very important kasi in children, anthropometrics is one of the measurements of growth and development. Okay, kapag ang bata hindi lumalaki ng tama, ibig sabihin may mali dyan. It's either may sakit, baka naman kulang yung nutritional intake, baka naman merong chronic diseases, ang daming possibilities. Okay, so make sure that you know how to interpret it. And there are different charts, WHO, CDC, but what we currently use right now would be your WHO charts, and we usually specifically use the Z-scores. Okay, dahil meron ding WHO na percentiles. But for your review, okay, and if you go into practice, if you go into residency, most probably you will be making use of the Z-scores. Okay, and the numbers to remember is 3210, -1, -2, -3, and this is how you interpret it. Okay, so length or height for age, we're talking about length or height. Pag mababa siya, ang tawag dyan stunting, so height alone. Okay, if you're talking about the weight for the age, yung timbang lang na tinitignan mo, ang tawag dyan underweight. Okay, for severe acute malnutrition, for SAM, okay, SAM, severe acute malnutrition, we are more concerned with your BMI if it's more than 5 years old, or your weight or length, weight for length or height. Okay, so again, if we're talking about malnutrition, ang mas urgent, ang mas importante would be the terms wasting. Okay, wasting or severe wasting. Pag less than -2, wasting. Pag less than -3, severe wasting. Okay, and how do you know if your patient is wasted? Okay, hindi yung wasted na nalasingan, ay pag-inuman kagabi. Hindi. How do you know if your patient is wasted? Your patient is wasted if the BMI for age is less than -2. Okay, for children 5 years and up. For less than 5, your patient is wasted if your weight for height or length is less than -2. So you plot the weight versus the length for height. Why am I emphasizing this? You can have a patient whose weight for age, okay, falls in the normal range or baka underweight lang yan. But then when you compare the weight for the height, wasted na pala siya. Pwede mangyari yun. So again, very important, BMI or weight for length or height. Our next topic would be on immunization. Okay, you have to know immunization. This is being asked in the board exams. Okay, there's around 1, 2, sometimes 3. Madami na yung 3 points for immunization. Okay, it's not much, but it's very important. Sayang yung 2 points, sayang yung 3 points. Okay, and you will be needing this knowledge for your practice. Dapat marunong kayo magbakuna. Okay, so we will go through the details, yung mga pinaka-importanting vaccines that you have to know. But first, I want you to understand the principles and the concepts behind your vaccines. That is very important. Okay, so prior to the pandemic, medyo mas simple lang ang buhay kasi dalawa lang yung type ng vaccines natin. We only have live and inactivated vaccines. Okay? So, inactivated vaccines, mga dead particles ng vaccine, yung tinutusok sa katawan natin. Versus sa live, ito yung mga buhay na vaccines pero weakened forms ng vaccines. And what's the difference? Well, yung live, usually hindi mo siya pwedeng ibigay sa immunocompromised. Usually hindi mo siya pwedeng ibigay sa mga pregnant patients. Okay? Yung live vaccines, meron tayong special rule in terms of scheduling, which I will discuss later. Okay? But now, we have a lot of different types of vaccines, di ba? Nandiyan yung COVID vaccines, meron ka ng mRNA, meron ka ng vector-borne vaccine, ang dami na, di ba? So, I'm not sure if they're going to ask you that in the board exams, but this one, definitely, it's a must know. It's a need to know for your students. Okay? So, it's very easy to memorize, okay? How do I remember which ones are inactivated, which ones are lives? Live, okay? What I do memorize are the live vaccines. Kakalimutan ko na to. Okay, huwag mo na i-memorize isa-isa yan. Mas marami yan. Ito na lang i-memorize mo, okay? Bakit ang suggestion ko is live lang yung i-memorize nyo, okay? Kasi yung live vaccine, again, sila yung special, sila yung bawal sa immunocompromised, sila yung may special scheduling, and sila yung mas madaling i-memorize. Why am I saying this? Bakit sila mas madaling i-memorize? Yung mga live vaccines, guys, sila yung mga hindi IM. Again, the live vaccines, they are the ones whose route is not intramuscular. Sila yung weird, sila yung kakaiba yung route. So, tingnan nyo, BCG is intradermal, measles, MMR, varicella, that's subcutaneous, rota is oral, influenza na intranasal. Meron kang influenza na IM, that is inactivated. Pero pag nasal, that is live. Typhoid, may typhoid na IM pero pag oral, live yan. Okay, oral polio and Japanese encephalitis which is subcutaneous. Okay? So, I hope you got that. Medyo mabilis, no? Pero yun, the live vaccines, they are the ones who's not given intramuscularly. Okay? And why is it important? Let's go over the principles. Okay? Simultaneous administration of vaccines. Pag tinanong kayo, pwede bang ibigay si Hep B saka si pneumonia na sabay? Okay, sabay, magkasunod, simultaneous on the same day. Okay? Or pwede bang ibigay si chickenpox saka si Japanese encephalitis, si MMR saka si diphtheria? Okay? Number 1 principle, very important. If we're talking about simultaneous administration, magkasunod. So, the same day, magkasunod. Okay? The answer is yes. Huwag ka na mag-isip. Okay? Huwag ka na mag-isip. Pag tinanong ka, pwede bang simultaneous? Yes. Just use separate syringes, just use separate sites. Okay? Except, the only exception that you should remember is yellow fever and cholera. Okay? So, except yellow fever and cholera. So, again, pwede silang simultaneously given except yellow fever and cholera. Okay, example. Nakalimutan ng mother yung kanyang MMR, tapos due na rin siya ng yearly na flu vaccine. Pwede bang sabay yung flu sa MMR simultaneously? Oh, bakit nag-iisip ka pa? Di ba, huwag ka na ngang mag-isip. Okay? Yellow fever and cholera, yun lang yung hindi pwedeng simultaneous. Yun lang yung dapat 3 weeks apart. All the rest, kapag ang tanong sa inyo, simultaneous, pwede ba? The answer is yes. Mas madali, huwag mag-isip. Okay? So here is a cheat code for your scheduling of vaccines. If it's inactivated and inactivated, dalawang inactivated, Hep B sa pneumonia, simultaneously pwede? Yes. Okay? Hindi ko siya napagsabay. Nabigay ko si Hep B ngayon, pwede ba akong mag-pneumonia bukas? Sabi dyan, no interval needed. Pwede. Okay? Eh, Dok, nagbigay ako ng Hep B ngayon, si pneumonia after 1 week, pwede. After 2 weeks, pwede. After 1 month, pwede. Okay? Pwede. Malinaw? Okay? Eh, paano, Dok, pag inactivated saka live? Kunwari, nagbigay ako ng chickenpox saka pneumonia. So, pneumonia is inactivated, chickenpox is live. Pwede ba silang sabay? Huwag ka na mag-isip. Yes. Okay? Eh, Dok, nauna ko nabigay yung chickenpox. Bukas, pwede ba yung pneumonia? Pwede. 1 week, pwede. Okay? Malinaw? Okay? Eh, paano kung live saka live? Yun ang may kakaibang rule. Sabi, if not given simultaneously, 4 weeks apart dapat. Chickenpox live, MMR live. Pwede bang sabay? O, nag-isip ka na naman. Yes, pwede. Pwede silang simultaneously. Okay? Pero Dok, nagbigay ako ng chickenpox ngayon. Pwede ba ako mag-MMR bukas? No. Next week? No. 2 weeks? No. If it's 2 live vaccines, you have to wait for 4 weeks or 1 month. Is that clear? And it makes life very simple. Dali lang pala. No? Tama? Diba? So, yun lang yun. Wala kayo ibang kailangan tandaan. Okay? So, yun lang yun. Vaccine combination. That's easy. Okay? Next, lapse immunization, catch-up immunization. Isa to sa mga topics na hirap ako intindihin. Nung clerkship, nung internship, nag-gets ko lang siya nung nag-top notch review na ako. Okay? It does not require reinstitution. Anong schedule natin usually ng API? 6, 10, 14 weeks. Okay? Nabigay mo yung 6 weeks. Hindi siya nakabalik ng 10 weeks. Bumalik siya 12. Anong gagawin mo? I-restart mo ba sa dose 1 or dose 2 ka na? Hindi ka mag-restart. Dose 2 ka na. Dok, 2 months bago siya bumalik. Dose 2 pa rin yun. Dok, 1 year na bago siya bumalik. Dose 2 pa rin yun. Hindi mo kailangan mag-restart. Malinaw? Ganun kasimple lang yung catch-up. Continue as if nakabalik siya. Okay? Because in vaccines, guys, pwede kang malate. Ang problema mo lang pag na-late ka is wala kang protection. But remember, hindi ka pwedeng maaga. You can never give it too early. When we say dapat 4 weeks apart yan, diba 6, 10, 14, hindi ka pwedeng earlier than 4 weeks or 28 days. Okay? Nitty-gritty, theoretically speaking, pwede hanggang 24. Okay? Pero para hindi magulo sa board exam, guys, 28 days. Okay? Yun yung karamihan ng interval ng most vaccines. Okay? So again, continue as if. Okay? As if yun pa rin yung dose niya. As if nakabalik siya on time. Okay? Just do make sure that that vaccine is still required. For example, rotavirus, merong age limit yan. So pag 1-year-old na, do not give your rotavirus anymore. For example, Hib and pneumococcal vaccine, it's only routinely given up to the age of 5. 5 years and above, hindi na siya routinely given. So pag may pumunta sa inyo, Dok, kulang pa ako ng isang pneumococcal dose, nabigay yung second dose niya ng 1-year-old, sabi ng pedya ko, babalik ako dapat after 1 month. Eh, 1-year-old siya, Dok, hindi ako nakabalik ako 3 years old na anak ko. Ano gagawin natin? Bigyan mo pa rin yung pneumonia niya. Okay? Pero ang pneumococcal is not routinely given for more than 5 years of age. So pag 6 years old na yan, Dok, ano gagawin natin? Ay, wala, okay na. Hindi na kailangan. Hindi na siya routine. Okay? Is that clear? Okay? And unknown immunization status. Sabi ni mother, Dok, hindi ko alam. May record po ba kayo? Wala po ako makita record. Makakapunta po ba kayo sa pedya nyo? Hindi po ako makakapunta. What do we do, Doc? Hindi ko po sure kung ano yung bakuna ng anak ko. Then we treat your child as if he or she has not received any vaccine or the vaccine in question. Because there's no evidence na may problema if masobrahan siya. Okay lang. Kung nari, Doc, madoble yung chickenpox, dapat 2 doses lang, naging 4. Kasi hindi ko sure kung nakadalawa na talaga siya. It's okay. There's no evidence that it will cause harm. Okay? Gastos lang. Diba? Sayang yung pera. Pero, kailangan mo ng protection. Okay? It's better that you over-vaccinate, nasobrahan mo yung dose mo, than you assume na meron kang protection, tapos wala pala. Okay? So please do remember the contraindications. You only have two permanent contraindications: anaphylaxis and for diphtheria. Okay. For pertussis, development of encephalitis, seizures. Pag yung bata nag-seizure within 7 days after a pertussis-containing vaccine. Specifically dun sa cellular form ng pertussis. Okay, kasi yung iba cellular, kaya nga DTaP, AP, di ba? Diphtheria, tetanus, acellular pertussis. Okay? And you have temporary contraindications if the patient is pregnant or immunosuppressed. Hindi ka muna pwede mag-live vaccine until that patient is pulled out of the condition we're talking about. So kung nanap siya, pwede na. Yung immunocompromised, pag hindi na siya immunocompromised, pwede na yung mga live vaccines. Okay? So inactivated, walang problema. Okay? Just going back here, nakalimutan ko banggitin. Guys, live, we're talking about parenteral. Okay? If you're talking about the live oral vaccines, it does not follow. Okay? So for example, chickenpox, saka, ano ba, polio. Okay? Okay lang yun. Kung hindi mo na pagsabay, wala pa rin interval. This is just live parenteral, yung tinutusok na vaccine. Okay? Okay, so in this next few slides, you will see the PPS recommended vaccines. Again, you have to memorize this. To give you a clue, para mas madali mag-memorize, by default, a lot of these vaccines would follow the schedule of 6, 10, and 14 weeks. Okay? 6, 10, 14. Okay? Booster is usually at 1 year old and at 4 years old. So medyo madali rin tandaan yan. Okay? And then you memorize the basic pattern. Pag sinabi kong basic pattern, yun 6, 10, 14, booster at 1, booster at 4. Okay? And then tignan nyo lang kung alin yung mga may nitty-gritty na kailangan yung tandaan. Okay? So again, we will discuss this in detail dahil this is for your clinical practice. So BCG is given at birth preferably within the first 2 months. Okay? Please remember the dose. Okay? It's 0.05 for less than 12 months. Pag more than 1 years old na yan, 1 year old na yan, 0.1 ml. Okay? DPT, what do you have to remember? Okay? The interval between the third and the fourth dose, meaning your booster, should be 6 months. Okay? 4 months is acceptable, sabi dyan. Okay? The fifth dose is not needed if the fourth dose is given at 4 years or older. So for example, nagbigay ka ng 6, 10, 14, hindi ka nakapag-booster ng 1, nag-booster ka 4 years old na, okay na yun, fourth dose, okay na yun. Pero pag nag-booster ka ng 1, 2, 3, 4, kailangan mo mag-fifth dose pa rin at 4 years of age para ma-consider siya na fully immunized against yung DPT. Okay? HIB, remember, it's not routinely given for those more than 5 years old. Unless, again, we're talking about routine. Unless you have a patient with complications, comorbidities, which will require vaccination even if he is more than 5 years of age. Example would be those with patients na merong asplenia. Kasi pag wala silang spleen, they are prone to encapsulated organisms. They're prone to be infected by encapsulated organisms. So kailangan ni HIB sila. Okay? Or poliovirus, polio vaccine is 6, 10, and 14. Okay? Booster 6 months from the last dose. Okay? So 6, 10, 14, and then after 6 months, usually nag-booster yan. Okay? So in the health center, what do they do? In strategy nila, tatlong oral, tapos nagbibigay sila ng isang injectable. Okay? Pneumococcal like HIB, it's not recommended for more than 5 years of age. Okay? For healthy children, 2 to 5, without previous vaccine, they may be given 1 dose of PCV13 only. So kunwari, nakalimutan sa health center, hindi lahat ng health center may pneumococcal vaccine. Tapos meron kang 3-year-old na never pa naka-receive ng pneumonia vaccine. Isang PCV13, okay na raw yun. Okay? Booster is 6 months after the third dose. Okay? So 6, 10, 14, then 6 months after the third dose. Okay? Rotavirus, remember, there are 2 forms, mono and pentavalent. Monovalent is 2 doses, pentavalent is 3 doses. And very important for rotavirus, meron kang maximum age, which is 32 weeks or 8 months. You do not give rotavirus past 8 months as there will be an increased risk of developing intussusception. Okay? That's the last dose. Okay? Ibig sabihin yung mga latter dose. For example, dose 2 or 3 for penta or dose 2 for mono. But also, please remember that you cannot start it if the infant is more than 15 weeks of age. So kung pumunta sa'yo yung mother, dok, ngayon lang po ako nagkapera, 20 weeks old na si baby, gusto ko po siyang ipa-rotavirus, hindi na rin pwede. Okay? Influenza. We know that influenza is given yearly. What did you know? Okay? In children, the initial dose is 2 doses 4 weeks apart dapat. For 6 months to 8 years old, if this is the first time that they will receive their influenza vaccine, it should be 2 doses, okay? 1 month or 4 weeks apart. Okay? So please do remember that. Okay? So, Doc, paano kung kunwari nagbigay ako ng 1 dose ngayong 6 months old siya, nakalimutan ko, next year na bumalik yung pasyente. What is the recommendation? 2 doses pa rin ulit. 2 doses pa rin ulit, bago ka mag-yearly. Doc, bumalik siya nung 1 year and 6 months old siya, nakalimutan ko ulit na 2 pala dapat. Okay? Ano nang gagawin ko, Doc? Naku, lagot ka 2 beses mo na nakalimutan. Okay? Ano nang gagawin mo? Yung next year, sabi ni PPS, kung 2 beses mong nakalimutan, sige na nga, pwede na yun. Okay, mag-yearly ka na lang. Every year mo na lang ibigay yung susunod. Malinaw? So again, flu vaccine 6 months, after 1 month, 7 months old siya, bigyan ko na isa, and then after that, yearly thereafter na. Okay? Kung nakalimutan mo, first time niya, hindi mo naging ginawang 2. Next year, gawin mo pa rin 2. Pero kung nakalimutan mo yung year, next year, nakalimutan mo ulit, tigas talaga ulo mo, sige na, bahala ka na. Sabi ni PPS, sige na nga, gawin mo na yearly na lang. Okay? And depending on the vaccine manufacturer, there are some that recommend giving half dose for patients 6 months old to 35 months. So 6 months to before 3 years old. Okay? Measles is given at 9 months along with Japanese encephalitis. Okay? Booster ng measles usually ang susunod din yung MMR. Japanese encephalitis, there's another booster dose after 1 year. Okay? For less than 18 years of age. Pero pag more than 18 years, 1 dose lang. Okay? MMR is given at 12 months and then a booster at 4 to 6 years of age. Okay? Varicella, hepatitis A, that's given also at 1 year of age. So madaling tandaan guys before 6 months, tandaan nyo na lang yung EPI vaccines nyo. Okay, ano yung mga EPI vaccines nyo? Penta, polio, pneumonia. O, 3 P. Madaling tandaan, di ba? Penta, polio, pneumonia, rotavirus. O, yun yung 6, 10, 14. Okay? Pagdating ng 6 months, isa ang binibigay, which is flu. Pagdating ng 9 months, 2 ang binibigay, which is Japanese encephalitis and measles. Pagdating ng 12 months, 3 ang binibigay, which is MMR, varicella, and hepatitis A. So nakita nyo yung pattern. 6, 9, 12, 1, 2, 3. 6 months, 1 vaccine, flu. 9 months, 2 vaccines, that's Japanese encephalitis and measles. 12 months, 3 vaccines, chickenpox, MMR, hepatitis A. Okay? So please do remember that. And of course, you have to know this. Everybody knows this. Your TD vaccine every 10 years. Okay? And you give it to pregnant patients, usually on the 3rd trimester, para mapasa niya yung mga antibodies kay baby to protect them for tetanus. Okay? Also, part of the recommended vaccines, please do not forget of your HPV vaccine, your human papillomavirus. Okay? And because we're living in a pandemic, sabi ko nga sa inyo, baka magtanong, relatively recent discovery, okay, and relatively new guidelines, we do offer COVID-19 vaccine we do offer COVID-19 vaccine now to pediatric patients. Ang meron pa lang tayong emergency authorization use here in the Philippines would be 12 to 17 years of age. But soon, I'm sure 5 to 11 will be going up next. Sa abroad, nagbibigay sila ng 5 to 11. And in children, if they will ask, ano ba approved vaccines, it's your mRNA vaccines, Pfizer and Moderna. Okay? And they're usually given 12 doses, interval, depende yan sa guidelines na sinusunod nyo. Minimum, I think, for Pfizer is 14 days. For Moderna, some guidelines recommend 28 days pa rin. Okay? So please brush up on those topics. You can search them. Again, the guidelines are ever changing. By the time na few months have passed, baka magpalit na ulit yan. let's now proceed to the discussion of more selected and specific diseases in pediatrics, right? So this discussion for the next few slides would be more of a question and answer case scenario discussion, okay? So let's have this case. You have a 7-year-old female brought into you due to fever for 3 days, headache, arthralgia, and myalgia, okay? Patient was noted to have a decreased appetite, okay, due to the abdominal pain and vomiting. On physical examination, the heart rate are as follows: 140 of heart rate, RR30, BP of 90/60, okay? There's flushed skin with full pulses and cold distal extremities. What will you advise this patient? Okay, except, sabi dyan, except, okay? So what are you thinking for this patient? So you have a 3-day history of fever, headache, arthralgia, myalgia, parang viral infection lang, di ba? And then you have what? You have abdominal pain, vomiting, and flushed skin. Very pertinent, di ba? So, at the top of your head, ano dapat ang unang iniisip dito? What is your top differential aside from systemic viral illness? Tapos may vomiting, may abdominal pain, di ba? Acute gastroenteritis, yes, pwede, pero usually hindi naglalagna't yan. Although pag dehydrated sila, pwede pa rin, okay? But if you put the case all together, mas isipin nyo dapat ay dengue, di ba? Dengue fever. So, may 3 days kang fever, tapos abdominal pain, myalgia, arthralgia, headache, which is usually retroorbital, di ba? Retro or periorbital ang description ng headache ng dengue. Tapos yung katawan niya masakit talaga, kaya yung ibang tawag sa kanya breakback fever. So, parang sobrang sakit ng muscle, sobrang sakit ng likod, kaya breakback fever, okay? And then you have flushing of the skin, although not all dengue would have flushed skin, pero very common in patients with dengue. So, what should you do? So, in dengue, the cornerstone is fluid management and monitoring of your CBCs. That's true, yes, that's true, okay? So, it's a viral disease, it's self-limiting. The problem is you have to monitor because some cases of dengue would have complications such as hemoconcentration, and thrombocytopenia. That's why you have to monitor the CBC. Okay, WBC and platelet counts are expected to be decreased. Yes, that is typical in dengue. Okay, but please mind you, a lot of viral illness will present with some form of leukopenia and thrombocytopenia. So hindi lahat ng mababa yung WBC ay dengue. Hindi lahat ng mababa ang platelet is dengue as well. Okay. And hemoconcentration is expected, of course, because of your plasma leakage. Your pathophysiology of dengue is plasma leakage, okay, leading to hemoconcentration. Okay, so if they ask you what are the 2 main pathophysiology of dengue, number 1, it's increase in capillary permeability. Okay, so yung capillary permeability mo tumataas because of the inflammatory process that's going on. And number 2, the increase in capillary permeability leads in plasma leakage. And because of the plasma leakage, ang consequence nun would be hemoconcentration. Lumalapot yung dugo. Okay, so the answer here is letter A. You cannot manage this patient as outpatient. Why? You have a warning sign. You have abdominal pain. Other than that, ano pa? Your patient is in a form of compensated shock. Although your BP is normal, your heart rate is already elevated beyond normal, di ba? 7 years old, heart rate mo 140, mataas yan, di ba? What is our expected elevation of heart rate? Okay, baka isipin nyo, hindi kaya yan tachycardic because of the fever lang. So if you were going to read the references, for every degree Celsius above 38, yung heart rate mo, it can increase by around 10 beats per minute. So yung 140, masyado mataas yan. Okay, and your patient has cold distal extremities. So lumalamig na yung extremities niya, again, that's a sign of shock. So you have to admit and hydrate this patient. Okay? In relation to the above case, so sabi natin, hindi lahat ng may thrombocytopenia, may leukopenia is dengue. Hindi lahat ng may fever na flush ang skin is dengue. So you have to test if this is really dengue. Okay, so one of the readily available tests would be your dengue IgM, IgG, and your NS1. Okay, of course, the gold standard would be detection of dengue particles. So I think there's a PCR test for dengue, but we don't use that left and right in clinical practice. It's not that readily available, and mas mahal yun. Okay, so what we use would be your dengue blot and your NS1. Okay, your NS1 is an envelope protein of your dengue. Okay, so hindi porket NS1 nakikita lang siya dun sa serotype na isang serotype ng dengue. No, you have 4 serotypes of dengue, and all of them will carry this NS1 protein. So please remember that. Okay, so going back. For this specific patient, what will you request? Okay? You will not request for everything in the panel. Okay? Usually, ang choice lang naman yan, NS1 or dengue blot. Usually, sabay na yung dengue blot, IgM and IgG siya. Okay? But please do remember the timing. Okay? For the first 3 days, the better test would be your NS1. Okay? Your IgM, it's expected to be positive on the 5th day onwards pa. Okay? So, for this case, 3rd day of fever, it's NS1. That's why it's very important to count. Sayang yung test, sayang yung pera, di ba? Kasi if ipa-IgM mo siya, IgM, IgG at this point, probably it will turn out negative. And it will not assure you na hindi talaga dengue yan. Okay? Is that clear? Okay. So, again, there are 4 serotypes from the family Flaviviridae. The vector is your Aedes aegypti. Okay? So, it causes increased vascular permeability or your capillary permeability, which leads to plasma leakage and shock. Okay, this is from the latest guidelines. Okay, so dati kasi ang daming ibang classification ng dengue, meron without warning signs like this one, with warning signs and severe dengue. This used to be the old classification, and then back in 2011, in-implement nila yung classification na yung dengue shock syndrome, dengue hemorrhagic fever na parang 1, 2, 3, parang ganyan, and then eventually binalik nila dito. So right now, this is what we are using. Okay, so this is dengue, so it's either without warning signs, with warning signs, or severe dengue if it falls into any of this criteria. So severe plasma leakage, hemorrhage, organ impairment. Okay, so this is the criteria for the warning signs and for dengue. So it's probable dengue if it lives in an area endemic of dengue, and fever with 2. Okay, 2 of the following, 2 or more: nausea, vomiting, rashes, aches and pain. Tourniquet test. Please do not forget your tourniquet test. Okay, so it's one of the signs of plasma leakage. So how do you do your tourniquet test, diba? 5 minutes, you put your BP cuff, inflate it midway between the systole and the diastole, and then you leave it on for 5 minutes. Okay, and then after that, in the antecubital fossa, you make a square, 1 by 1 inch in a square. Okay, you make a 1 by 1 inch in a square, and then you count. Okay, so the positive value would be 20. Okay, some references would say 10. So tumataas yung specificity ng test na yun. So 10, some would consider it positive, pero sabi nila, pag 20 yung PTK na nabilang nyo, then there's a very high probability, if I'm not mistaken, around 95% probability that this is dengue. Okay? So leukopenia or any warning sign. Okay? These are your warning signs, so abdominal pain, persistent vomiting, fluid accumulation such as pleural effusion, ascites, mucosal bleeding, so lips, gums, gum bleeding, nose bleeding, okay? Lethargy, restlessness, liver enlargement, increase in hematocrit, usually more than 10% increase in hematocrit, okay? And for shock, ito yung mga criteria mo. So shock, hypotension, okay? Accumulation of fluid with respiratory distress, severe bleeding, elevating of liver enzymes, and okay, CNS impairment, and other end organ damage. So again, this is the timeline on when to do your test, okay? So your NS1 can actually be positive on the first day of fever and up to the 3rd day. Okay? So up to the 3rd day, yung chance na makapag-detect ka ng NS1 bumababa na yan. On the 5th day, dyan palang mataas yung IgM. Okay? So technically, what I do, day 1, day 2, day 3, I test for NS1. Day 4 is kind of a gray zone. Pwede mo pa rin mahuli yan. Pero I'd rather wait because if it's clinically compatible at mukhang dengue siya, your management will not change naman. I'd rather wait and then just confirm and do your dengue blot, your IgM, IgG on the 5th day. Okay? Dahil kuminsan, when you take it on 4th day, kuminsan pwede mag-negative yung parehas na test mo. So medyo gray zone yung 4th day. Alright? So other important things that you want to know on dengue, already said, this pathophysiology. Okay, the rash is usually a blanching macular rash. Okay, and during the phase of recovery, pag pagaling na sila, nagkakaroon na ng tinatawag na Herman's rash. Okay, so I will put in this slide a picture of my recent patient with dengue and yung example ng Herman's rash. Ang description niyan is parang islands of white tapos on a sea of red. So yung iba, ang description niya parang grain of salt on a sea of red. Pero pag grain of salt on a sea of red, tapos nasa bunganga, that's your Koplik spot, di ba? So ang Herman's rash is more of like parang islands sila, islands of white on a sea of red. Okay, how do you resuscitate dengue with shock? With compensated shock, you give your 10 to 15 cc per kilogram of fluids over 1 hour. If it is hypotensive shock, you give it via bolus, 20 cc per kilo. Okay, and please remember blood transfusion is not routine. Okay, before we go on to the next topic, other more points that are very important in dengue. Please remember that your dengue has several phases. Your febrile phase, wherein the patient has fever. Your critical phase, which is the first 48 hours of defervescence, pag nawala na yung lagnat, 24 to 48 hours, and then your recovery phase, okay? During the febrile phase, your problem usually is dehydration. Kasi hindi makakain yung pasyente, naglalagnat siya, ang dami niya insensible losses, okay? The critical phase is the most dangerous. That's why it's called critical. So usually, yung first 24 hours, okay? In the book, it's 24 to 48 hours. Pero what we see clinically, yung first 24 hours yung pinakadelikado. And what happens there, that's where your plasma leakage comes in. So, nagkakaroon ng severe plasma leakage, masashock yung patient, babagsak yung platelet, nagkakaroon ng bleeding. So, kaya siya critical. Okay? And then, if may tawid yung patient successfully sa critical phase, papasok na siya sa recovery phase. Wherein sa recovery phase, babalik na yung appetite ng patient, lahat ng plasma na na-leak niya, eventually it gets reabsorbed. So, mapapansin mo, magkakaroon ng diuretic episode yung patient na dati hindi siya umiihi dahil nag-shock siya, tapos during the recovery phase, yun na, umiihi na siya kasi nare-absorb na lahat ng fluids na nilabas niya during the plasma leakage stage. Okay? And again, please do remember, majority of patients with dengue will recover without problems. A lot of patients had dengue na parang trangkaso lang, hindi naman sila na hospital. But we have to monitor these patients because we do not know, okay? We do not know kung sino yung mga magkakaroon ng mortality or morbidity, okay? Kung sino yung magkakaroon ng complications, okay? There have been several studies that try to predict the severity of dengue based on the presentation, pero as far as I'm aware, currently wala pa ring full set of guidelines or parameters that will accurately predict na pag ito, ganito, ibig sabihin mas papangit yung dengue na yan. Wala, okay? So we still go with clinical presentation and monitoring of the patient. Next case, you have an 8-year-old male who was brought to your clinic for chronic sneezing and cough, which is more prominent in the morning. So we get this a lot in the clinic. So doc, inuubo po siya on and off. Gano'ng matagal na po, months na po eh. Buong araw po siyang inuubo. Doc, usually pagising sa umaga. So yun yung mga conclusion dyan, pagising sa umaga. Okay? And father and mother are known as asthmatic, so there's a high history of atopy in the family. Okay? Upon physical examinations, the patient had watery nasal discharge and pale, boggy turbinates. Okay? There's also allergic shiners. Sa mata niya. Okay? For the past 2 months, the patient has been having almost daily attacks. Okay? With difficulty sleeping. So how do you classify this patient's disease? So what's disease is first? Ano bang sakit yan? This is allergic rhinitis, very common, di ba? So you have family history of atopy, chronic rhinorrhea, sneezing, okay? Sometimes even coughing because of the post-nasal drip. Okay? And it interferes with the patient's activity of daily living. So your ADLs, di ba? So past 2 months, more than 4 days per week. For the past 4 weeks, you classified it as moderate to severe persistent, di ba? So madali lang siyang i-classify. Go back to your ARIA guidelines. Mamaya discuss natin yun. Meron pa isang question. What is the drug of choice for this patient? So the drug of choice for allergic rhinitis would be your topical, your intranasal steroids. Okay? Lalo na pag persistent to severe yan. Okay? Persistent, moderate to severe. Okay? So allergic rhinitis is a disease of your nose, okay? Wherein the mucosal lining of your nose is sensitive to your allergens, to your triggers, and it becomes inflamed. So it's like asthma. It's an inflammatory process. Okay? It's usually diagnosed before the age of 6. Ibig sabihin, based on the clinical pattern, usually nagre-present yan early on, habang bata pa lang yung pasyente. And before the age of 6, a lot of these patients are already diagnosed with allergic rhinitis. So bata pa lang sila meron na. So there are different types. 20% are seasonal, sabi ni Nelson, 40% are perennial, 40% are mixed. But in clinical practice, medyo hindi na ganun ka nagmamatter yung pag-classify niyan. Okay? Because the management would be somewhat similar. Okay? So there's an early phase and a late phase reaction. This is nice to know. Okay? Pathophysiology of allergic rhinitis. It presents with sneezing, rhinorrhea, obstruction, itchiness. Okay? And sometimes even your ears and your eyes are affected. So you can have itchiness of the pharynx, the ears, the eyes, okay, and not just the nose. Okay? On PE, you can see your pale mucosa. Okay? There could be a clear nasal discharge, and this patient's clinically usually may mga mannerisms yan, such as the allergic history of atopy, chronic rhinorrhea, sneezing. Okay? For allergic rhinitis would be your topical, your intranasal steaming, yung ilalim ng mata nila. Okay? Management for allergic rhinitis, of course, what they teach you in med school, there are 4 cornerstones in management. Number 1 is, of course, avoidance of trigger. Diba? Kailangan mong i-avoid yung trigger. Okay? And then number 2 is your pharmacological management, wherein you give your medications. Number 3 is patient education. Diba? Kailangan mo ituro sa kanila, you have to avoid your triggers, kailangan tuloy-tuloy yung medication mo, you can clean your nose with saline wash, ganyan. Tapos dapat alam nila na this disease is chronic, it has a characteristic to become relapsing on and off, okay? Para alam nila yung nangyayari sa kanila. And lastly, pag talagang hindi gumagana yung mga pharmacotherapy, allergen avoidance, you go to immunotherapy. Okay? So immunotherapy. So, this is from the ARIA guidelines, 2019, if I'm not mistaken. Okay, so for patients presenting with rhinitis, lalo na pag chronic yan, there are questions that you can ask, which will point you if this is more likely to be allergic in origin or not. Okay, so for example, these symptoms over here, okay, unilateral symptoms, thick greenish discharge, post-nasal drip, facial pain, nose bleeding, and loss of smell. These symptoms are not common in allergic rhinitis. So pag unilateral yan, baka infectious process, baka may foreign body obstruction pala, lalo na pag may mga discharge, pag may facial pain, you will consider, ano yun? Diba? Pwede siyang rhinosinusitis, okay? Kapag mayroong recurrent nose bleeding, baka may mass yan, may tumor, loss of smell, baka may ibang problema yan. So these are not common, okay? Of course, it doesn't mean na pag may loss of smell, hindi na siya allergic rhinitis, diba? It doesn't mean na pag may post-nasal drip, hindi na siya allergic rhinitis. It's simply telling you na these are not common. As compared to this group of symptoms down here, watery nose, sneezing, especially violent and in bouts. Typical yan sa mga allergic rhinitis, pag bumahin yan, tuloy-tuloy, aching, diba? Nasal obstruction, itching, and conjunctivitis. These symptoms are very common in allergic rhinitis, okay? And ito yung sinasabi ko sa inyo, how do you classify? So the magic number is 4-4. So 4 days per week and 4 consecutive weeks, it's classified as persistent. Pag hindi siya pasok, pag less than 4 or less than 4 weeks, intermittent lang yan. Difference ng mild to moderate, basta meron kang interruption of activities of daily living. Okay? Dapat sa mild, all of the following. Dapat walang interruption, normal sleep, walang activities na impaired, normal work, ganyan. Any one of these, moderate to severe na siya. Okay? And how do you manage it? Again, you can use your intranasal steroids. Going to read the references. For every degree Celsius above 38, yung heart rate mo, it can increase by around 10 beats per minute. So yung 140, masyado mataas yan. Okay? And your patient has cold distal extremities. So lumalamig na yung extremities niya, again, that's a sign of shock. So you have to admit and hydrate this patient. Okay? In relation to the above case, so sabi natin, hindi lahat na may thrombocytopenia, obstruction, itching, and conjunctivitis. Tuloy-tuloy yung medication mo, you can clean your nose with saline wash, ganyan. Tapos dapat alam nila na this disease is chronic, it has a characteristic to become relapsing on and off, okay, para alam nila yung nangyayari sa kanila. And lastly, pag talagang hindi gumagana yung mga pharmacotherapy, allergen avoidance, you go to immunotherapy. Okay, so immunotherapy. So, this is from the ARIA guidelines, 2019, if I'm not mistaken. Okay, so for patients presenting with rhinitis, lalo na pag chronic yan, there are questions that you can ask which will point you if this is more likely to be allergic in origin or not. Okay, so for example, these symptoms over here, okay, unilateral symptoms, thick greenish discharge, postnasal drip, facial pain, nose bleeding, and loss of smell. These symptoms are not common in allergic rhinitis. So pag unilateral yan, baka infectious process, baka may foreign body obstruction pala, lalo na pag may mga discharge, pag may facial pain, you will consider, ano yun? Di ba? Pwede siyang rhinosinusitis, okay? Kapag mayroong recurrent nose bleeding, baka may mass yan, may tumor, loss of smell, baka may ibang problema yan. So these are not common, okay? Of course, it doesn't mean na pag may loss of smell, hindi na siya allergic rhinitis, di ba? It doesn't mean na pag may postnasal drip, hindi na siya allergic rhinitis. It's simply telling you na these are not common. As compared to this group of symptoms down here, watery nose, sneezing, especially violent and in bouts. Typical yan sa mga allergic rhinitis, pag bumayin yan, tuloy-tuloy, aching, di ba? Nasal obstruction, itching, and conjunctivitis. These symptoms are very common in allergic rhinitis. Okay? And ito yung sinasabi ko sa inyo, how do you classify? So the magic number is 4-4. So 4 days per week and 4 consecutive weeks is classified as persistent. Pag hindi siya pasok, pag less than 4 or less than 4 weeks, intermittent lang yan. Difference ng mild to moderate, basta meron kang interruption of activities of daily living. Okay? Dapat sa mild, all of the following. Dapat walang interruption, normal sleep, walang activities na impaired, normal work, ganyan. Any one of these, moderate to severe na siya. Okay? And how do you manage it? Again, you can use your intranasal steroids. Okay? Antihistamines are also part of the management. Of course, decongestants, depending on the symptoms. This is for the old guidelines, guys. Ito yung mas old na ARIA. Okay? It's much more simpler. Kaya ako siya pinapakita sa inyo para may idea kayo. Because I don't think that for the board exam, they will ask you the specific flowchart and details of management. But you have to see this, you have to know para may idea kayo. Okay? So, dito sa old guidelines, pag mild lang siya at intermittent, sabi dyan, not in any preferred order. Ibig sabihin, you can use anyone. Okay? So, pwede kang oral antihistamine, pwede intranasal antihistamine, plus minus decongestant. Leukotriene inhibitor, Montelukast, pwede siyang add-on pero hindi siya ginagamit na primary drug. Okay? For moderate to severe and persistent symptoms, you can use, again, not in preferred order. Pwedeng oral antihistamine or intranasal antihistamine, plus minus decongestant, and then after 2 weeks, you review. Pag hindi gumagana, mag-step up ka, mag-steroids ka. Okay? So, kapag moderate to severe siya, ito na yung in preferred order. So for our patient in our case, di ba, persistent, moderate to severe, the preferred drug would be your intranasal corticosteroids. And then you can add antihistamine, okay, pwedeng oral para intranasal, plus minus leukotriene inhibitor, antagonist. Okay? And then they ask you gaano katagal bago mag-review ng symptoms, usually 2 to 4 weeks you review it. If nag-improve, step down treatment. If hindi, pwede kang mag-step up. Okay? So, this is the old guidelines. This is the 2020 guidelines. Medyo mas madami. Okay? So, again, we won't discuss this. I'm just showing it to you para may idea kayo. Okay? Probably you will use this for clinical practice. Okay? Sa board exam, tatanungin ba yan? I don't think so. Okay, pero please do browse this. Do have a look. It's in your ARIA 2020 guidelines. It's available for download. So, meron na siyang level of recommendation yan. So, yan. So, daanan natin mabilis. Kunwari, mild intermittent symptoms. So, kapag may mild intermittent ka, you can start with your oral antihistamine or inhaled intranasal antihistamine. They prefer this dahil mas mabilis yung onset niya. Okay? Pero you can also give actually your oral antihistamine plus decongestant, or you can actually start now with intranasal corticosteroids. So, any of these three you can do. Okay? So, expert opinion yan. 1, 2, 3 order. Okay? So, plus minus PRN yung saline spray pang linis. Okay? So, ito yung preferred. Pag hindi tolerated or hindi available, pwedeng 2, pwedeng 3. Okay? Pero pag moderate to severe na siya, mas earlier na pumapasok yung intranasal corticosteroids mo.